Hi everybody, welcome to the Functional Neurology Center Concussion and Brain Recovery Summit of 2025. Today in this video we are going to be learning about concussion and TMJ and talking about the jaw, neck, and brain connections. I am Dr. Alexis Romas, I'm a chiropractor, and let's get into it. Alright, so the concussion and jaw connection. So what our goals are for today are to explore the relationship between concussion, the trigeminal system, TMJ dysfunction, and how trigeminal nerve stimulation, or TNS, may offer therapeutic potential. TMJ, or your temporal mandibular joint, has connections to brain, your cervical spine, and the autonomic system, which are all overlooked in concussion care. After head injury, TMJ dysfunction and trigeminal sensitization can exacerbate concussion symptoms. Recent research shows that after head injury, TMJ dysfunction and trigeminal sensitization can exacerbate concussion symptoms, including headaches, dizziness, cognitive fog, and autonomic imbalance. So this is really a big deal. So, the trigeminal system is a neurological gateway. What is the trigeminal nerve? The trigeminal nerve, or cranial nerve 5, is the largest cranial nerve and is responsible for sensory input from the face, teeth, and TMJ. So the key connections that we have, your vestibular nuclei, because it can influence on dizziness and balance, cervical afferents, C1 through C3, forming the trigeminocervical complex, or the TCC, autonomic centers, shaping sympathetic and parasympathetic, and the cerebellum, which is coordination of head, neck, and jaw movements. So implications of trigeminal dysfunction. Trigeminal dysfunction isn't just jaw pain. It can lead to a cascade of symptoms, including vestibular disorders, cervicogenic headaches, autonomic dysregulation, and post-concussion syndrome. This is a massive player in all of these different things, and it tends to be overlooked. So, microglial sensitization and trigeminal pain. So the inflammatory cascade post-concussion. Concussions trigger an inflammatory response that sensitizes the trigeminal nerve, as shown in a study done by Tybersky. So key findings of microglial proliferation and astrocytosis in the trigeminal pain system. Microglial cells are essentially your immune cells in your central nervous system, while astrocytes are the structural support and protectors of our brain and spinal cord. We can get recruitment of too many of these microglial and astrocyte cells post-concussion, which can overload the whole system, including this trigeminal pain system. You can also have increased neuropeptide release, amplifying pain sensitivity. So increasing neuropeptide release can be triggered by high frequency of firing, which can depolarize your neuronal tissues, making your cells closer to threshold. As these cells are closer to threshold, it increases sensitivity to pain. So symptoms of trigeminal sensitization post-concussion are persistent headaches, heightened light or noise sensitivity, and pain triggered by chewing or jaw tension. So repeated head injuries prime the trigeminal system into being hypersensitized, causing normal responses to be over-heightened and can create excessive pain. So, the jaw-neck-brain loop. How are the TMJ and cervical spine are connected? The TMJ and cervical spine are biomechanically and neurologically inseparable. The trigeminocervical complex, or the TCC, links them, meaning dysfunction in one can worsen the other. So examples of these dysfunctional interactions, if you have cervical instability or whiplash, it can increase jaw clenching and TMJ pain. Bruxism and malocclusion drives tension in your neck muscles, leading to cervicogenic headaches. Impacts on vestibular and autonomic systems. Both of these dysfunctions contribute to dizziness, fatigue, and autonomic overload. So addressing the neck and cervical spine separately, addressing the cervical spine and TMJ separately may not be enough to make a plastic change in post-concussive care. Combining the two might have a greater impact. So, the TMJ autonomics and concussion symptoms, TMJ dysfunction can drive autonomic disturbances, contributing to sympathetic overdrive, poor parasympathetic tone, trigeminal vestibular interactions, and has an overall systemic impact. So let's break that down a little bit more. TMJ dysfunction can drive autonomic disturbances, contributing to sympathetic overdrive with bruxism or jaw clenching. Poor parasympathetic tone can cause sleep disruption and fatigue, and trigeminal vestibular interactions can cause ear fullness, tinnitus, and dizziness. So the systemic impact we have of all of this is that TMJ is not just a local problem, it perpetuates a systemic imbalance, exacerbating concussion symptoms. So what is trigeminal nerve stimulation? TNS is a neuromodulatory technique aimed at altering the activity of the trigeminal nerve to reduce pain and inflammation. So a 2020 study in neuromodulation had some key findings that showed reduced brain edema and inflammatory cytokines, decreased microglial activation and improved behavioral outcomes, altered brain activity on a functional MRI, indicating system-wide neuromodulation. So this shows that there are serious potential benefits for concussion patients, and that TNS could complement traditional concussion therapies by addressing this neuroinflammation and promoting recovery. So the Functional Neurology Center approach. So we'll look at a lot of different things, but we'll also be doing a TMJ and trigeminal assessment because it's an integral part of post-concussion evaluations. So interventions may include jaw proprioceptive retraining by improving input into the trigeminal system, vestibular ocular rehabilitation by reducing sensory overload, cervical spine stabilization, calming that trigeminocervical complex down, low-level laser and PEMF therapy for neuroinflammation, breathing techniques and vagal stimulation to balance out sympathetic and parasympathetic tone in collaboration with neuromuscular dentists for bite stabilization. So there's a lot of different therapies that we utilize in order to have an all-around approach to help with post-concussive symptoms. The future potential of TNS. Non-invasive TNS could become an integral part of concussion recovery, addressing both symptoms and underlying neuroinflammatory processes. So a case example that we have is a 29-year-old female with multiple concussions. So her symptoms are daily jaw pain, dizziness, and severe headaches. Some clinical findings that we had were TMJ dysfunction, bruxism or grinding your teeth, and abnormal vestibulo-ocular reflexes, as well as trigeminal trigger points reproduced her dizziness. So the rehabilitation program utilized was graded aerobic training, vestibular and cervical rehab, TMJ mobilization and desensitization, photobiomodulation therapy for neuroinflammation. The outcome of all of these different program techniques that we utilized was 70% reduction in jaw pain, significant improvement in headaches, and returned to full-time work in 12 weeks. Now, note that TNS was not directly utilized here, but it highlights the power of trigeminal-focused rehabilitation, and utilizing that helped make that big of a difference. So in conclusion, concussion can lead to persistent symptoms due to trigeminal sensitization and TMJ dysfunction. The jaw-neck-brain connection is central to understanding post-concussion recovery. Trigeminal nerve stimulation holds promise for addressing underlying neuroinflammation, offering new hope for concussion patients. So the next step for clinicians is to integrate TMJ and trigeminal assessment into post-concussion care. Consider incorporating TNS and other neuromodulatory techniques in treatment plans. These are the references we utilized here in this PowerPoint presentation, and I want to thank you all again so much for sitting and listening with me, and I really hope you got something out of that, and I hope you guys have a great rest of your day. Thank you.